I felt the distress and sadness radiate from Joy. Living in a homeless hostel for 2.5 years had been a discomforting, humiliating, and overall dehumanizing experience for her. The hostel was in the next city, an unfamiliar one for her, and the reason that she was living there was because of the domestic violence she had suffered, which led to her becoming homeless when she separated from her partner. Joy was referred into our service by her GP back in September 2020 for lower back pain and hip osteoarthritis. She had seen our advanced practice team, a physiotherapist, and other members of our pain team before coming to see me, totaling 9 appointments altogether. The functional limitations of her pain and the impact this was having on her depression had been identified at various points throughout these appointments. And the main focus of the rehab so far had been around improving her walking, as she was having to use 2 crutches. Joy had been managing well with the exercises and plans set out by the physiotherapist, and as a result she was seeing improvements with her back pain and also her walking. She'd also been referred to a mental health team for her depression, and she was taking an antidepressant. Fortunately, the main issue that was causing most of her distress, which was leading to an increase in pain and lower mood, was not identified until May 2021. That was 8 months after she entered our service. Thankfully, my pain management colleague asked some really probing questions, and Joy confided that actually a lot of her issues were stemming from the fact that she was living in the homeless hostel in a different city from the one she was used to, which was making her feel socially isolated and really low in mood. So it was agreed at this appointment that Joy would benefit from a face-to-face assessment to assess her levels of function. And that's when she was referred to me. I first met Joy in my pain clinic in September 2021, a year after she'd been referred into our service. As I do with all my patients, I first set out by asking Joy what she would like to get out of her time under my care. She informed me that she was desperate to be rehoused because this was causing her a lot of distress at the moment. Now, I could have left things there and said that, rehousing is out of my control as a physiotherapist, but I decided to dig a little deeper. So I asked Joy, what is the biggest barrier right now that is preventing you from being rehoused? It was then that Joy told me that she'd actually been offered various homes over the past 2 years, but she had to decline all of them because they all had stairs, something that she wasn't able to do at the moment because of her hip and groin pain. So I asked her if she would be happy to try a step up now, and she agreed. So I quickly ran out of the clinic space, grabbed a step, and I came back into the room. So we tried a step up in the clinic room with support, and I could see the determination in Joy's face that she really wanted to do the step up. But unfortunately, Joy couldn't even lift her leg up high enough to place her foot on the step, let alone do a step up. And this was because of her hip weakness and her pain that she was experiencing. On testing, I had a look, and actually her hip flexion was limited to 70 degrees. She looked at me with eyes filled with tears, and she just kind of said, I don't know what to do. I can't carry on like this. I really need to move out of this hostel. Joy then described some of her living situation to me that was actually quite shocking. So she was sleeping on a child's bed with some of the slats missing. And to try and combat this, she had got some cardboard, and she had placed the cardboard underneath the mattress to stop it from sagging down. When she went out of her room to practice walking, she was getting derogatory remarks from other people living in the hostel about her weight and the fact that she was having to use 2 crutches. And this wasn't only having an effect on her ability to exercise, but it was also having a massive strain on her mental health. It was clear that something needed to be done, so we set a rehab plan specifically around improving lower limb strength and hip mobility. And we set a short-term goal of being able to lift her foot onto a step, and a longer-term goal of completing a full step up with support. I sent Joy away with the exercises of seated hip flexion, progressing to standing hip flexion when she was able to, alongside her other weight-bearing exercises, which included sit-to-stands and half deadlifts, and also walking as well, which she was already doing. What happened next absolutely shocked me, because when Joy returned a month later, not only was she able to place her foot onto the step, but she showed off and she completed 5 step-ups in a row on her painful side. I actually started off with the step at a really low level initially, until Joy came along and just absolutely smashed it, and she was able to do it with such ease that we moved the step up to a higher level, and that kind of represented a normal size step. And she was able to do 5 on her painful side on that step. I was absolutely blown away of the progress within just a month. So I asked her how she'd managed this significant improvement in a relatively short amount of time. And she told me that she had actually gone and asked someone in her hostel to put some concrete slabs in her room and build these up to 3 different levels to represent a small step, a medium-sized step, and a large step. As Joy had now achieved the short-term and the long-term goal that we'd set out at the last appointment, we set some new ones. So the new short-term goal was to be able to complete a full flight of stairs at the hostel using the rail for support. The longer-term goal was then to be able to get confident doing the stairs so that she would be able to accept the next house that was offered to her so that she could finally move out of the hostel. I waved at Joy as she left my clinic that day, and I was smiling to myself, thinking about how determined somebody has to be to ask someone to move concrete slabs into their small room so they can practice stepping up. I next saw Joy in November 2021, a month after our previous appointment. Now, I probably shouldn't have favourite appointments, but in my 7 years of being a physio, this was absolutely my favourite appointment of all time. And I'm going to explain why by reading the reflection that I wrote after this appointment. Joy walked into the clinic with her 2 crutches. Although her mobility was clearly still a challenge, she had a buoyant look about her. She told me that she is now able to do a full flight of stairs up and back down again. Last week, she was offered a house back in her local area and she was able to accept it because of this. She also has a private back garden at her new home that she can practice her walking in without comments from other people. Being back in an area familiar to her meant that she could meet up with her friends again, who had been a great support during the previous abusive relationship that she was going through. She also told me that this had given her so much more hope than she had previously. Joy told me that day that she'd been living in that homeless hostel for 2 years and 5 months. 2 years and 5 months that she could now put behind her. I've changed this lady's name to Joy to protect her identity, but also because joy was the overwhelming emotion that was felt in that appointment and for the rest of that day. I was fortunate enough to be the one who received this great news from Joy on that day, and I shared this with all my colleagues who'd been on the journey with her. It really can't go unnoticed, the good work that my colleagues did in helping Joy build up her function and her lower limb strength. However, the simple focus of the rehab set around the thing that was most important to her, in this case stepping up onto a step, was really the catalyst that moved things forwards for Joy. We often overcomplicate things when attempting to help people with pain, whether this is a complex plan of 10 exercises, a medication, or an injection that only plasters over the issue for a short period of time. In this case with Joy, and in all pain management and rehab cases, err on the side of basic. Find out what's the most important thing to them right now and help them address it. Do one thing, but do that one thing well. So what's next for Joy? Well, the last time that I saw her 2 months ago, she was no longer on an antidepressant and her back pain was only there intermittently. She still had pain and functional limitations, but she was in a much happier place. The next goal, to be able to walk more upright and without crutches. To find out how you can help your patients achieve what's most important to them, just like Joy did, watch this next video to learn how I help my patients set values-based goals. Thanks for watching, take care, and I'll see you next week.